The rising cost of healthcare is causing some Americans to find cheaper options abroad. And that's leading to one of the fastest growing sectors in the travel industry, medical tourism. CBS News travel editor Peter Greenberg is with us. Peter, good morning.
And good morning, Nora. You know, America spends more on healthcare than any other nation. And those costs are now forcing a growing number of uninsured or underinsured Americans into traveling abroad for medical treatments, many times at a fraction of the cost.
Anything bothering you?
66-year-old John Wilson first came to Panama on vacation when he heard about the country's first-class healthcare system.
When I was at the airport and met other people coming to Panama, they were talking about the medical system here.
Wilson, a retired telecom worker from Atlanta, had been told that he needed dental implants, an expensive procedure that his insurance didn't fully cover. After doing some research, he ended up here, at the Pacific Dental Clinic in Panama City. Still, he wasn't convinced. So what'd you do?
So I came down and I sat outside the main lobby and I watched people coming out, and then I would ask them about the quality of care they got here, and they all raved about it.
So before you opened your mouth, you depended on word of mouth?
Absolutely, absolutely. Panama
is not the only popular destination for medical tourism. In Colombia and Vietnam, hip replacements, one of the most popular surgeries, average less than $10,000. In the U.S., $50,000. The same can be said for heart bypasses, as little as $11,000 in Malaysia or $25,000 in Israel. In the U.S., $144,000. How much would these treatments have cost you, these implants have cost you in Atlanta?
Well, the lowest price I got was about $27,000.
And in Panama?
In Panama, it's $7,000.
So about a quarter?
About a quarter.
In terms of the quality of care, many of the doctors that cater to visiting Americans were educated in the United States. They now work at hospitals affiliated with some of the most reputable institutions in America, including the Cleveland Clinic and Johns Hopkins University Hospital. Its affiliated hospital in Panama City is run by Dr. Moises Zebedee.
When we started our practice here, we said we need a hospital that has the level that we had our training.
Zebedee says medical care in Latin America includes aftercare with a private nurse and recovery time at a nearby resort.
I do rounds every day, room by room, to touch and see how are the patients doing.
For some people, traveling abroad for medical reasons is not just a money saver, but a way to receive treatments not available at home. Susan Sportsman came here from Texas for stem cell treatments not approved by the FDA. She hopes they'll help cure her arthritis, at least in the short term.
What I've invested here, I expect will be a short gain in the long run because I won't be on medications. I won't have complications from those medications. I won't have to have joint replacements, so forth and so on.
And if worse comes to worse, it's not a bad postcard.
It's not. It's not. It's a great place.
Now, one of the biggest issues with medical tourism is finding an institution not only through word of mouth, but by checking its rating through an international review board. Now, it should also be stressed that some of the most serious procedures require a great deal of aftercare. So that should be factored into any decision to become a medical tourist. Now, as for Susan Sportsman, she told us she's pain-free and doing well, and she plans to return to Panama for additional treatment and, get this, a vacation in the next 6 months.